Hello everyone, it's your fave eye doctor Nara here. Welcome back to my YouTube channel. In today's video, I'm going to be answering a very pressing question which is on the lips of every spectacle wearer. And when I say spectacle wearer, I mean you make use of glasses to see better. So you've gone to an eye clinic, you were diagnosed of having a refractive error, and glasses were prescribed to you to see better. Then this question is on your lips. This is because I've actually lost count of the number of times I get asked this question at the clinic, and I'm pretty sure other optometrists can relate to this when they watch this video, because it's something you guys are always asking at the clinic. So this famous question is, Doctor, I've been making use of my eyeglasses for about 2 years, 3 years now. When is this glasses going to treat entirely the defect you say I'm having, so I can drop off the glasses and start using my normal eyes? If you're on this table, sit back, grab your popcorn, because it's about to be a movie. I'm joking. Let's explore the answer to this question. Now, before I get into answering this question, I'd like to lay some background, and it is important for better understanding. So the first background I'll be laying is on refractive error. Obviously, the reason for which you need glasses to see better is because you have a refractive error. The underlying reason why you need eyeglasses to see better is because you have a refractive error. So let's get to understand what this refractive error is. When you have a refractive error, it simply means that your eyes are having difficulty in focusing the light that is reflected off the image you are looking at on the right spot of your retina for you to see that image as clear and as a sharp image. So let's take for an example now. For you to see this bottle, light from the surrounding environment is going to hit this bottle, and this bottle is going to reflect some of those light into your eyes, and this light is going to pass through some structures in your eyes like your cornea, your lens, and then it's going to get to a focus on your retina, and thereafter it's going to be converted to electrical impulses and then sent to your brain. Your brain interprets it and now tells you that what you're looking at is a bottle for you to see this bottle. But when you have a refractive error, the light that is reflected off this bottle is not focused on the right spot of your retina. It is either focused in front of your retina or behind your retina or on different spots of your retina, and that is why the image appears blur to you instead of a sharp and a clear image. The reason why your eyes cannot focus this light that is reflected off that image you're looking at on the right spot of your retina is because of the shape of your eyeball. Please take note of this, the shape of your eyeball. So it could be that your eyeball is longer than normal, the normal length, or probably your eyeball is shorter, or maybe your cornea is irregularly shaped. So in a case where your eyeball is too long, like in the case of myopia, the light that enters into your eyes is focused in front of your retina because your eyeball is too long. In the case where the eyeball is too short, the light that enters into your eyes is focused behind your retina because of the shortness of your eyeball. So you see, either of these, the image you're looking at is going to appear blurry. While in the case of astigmatism, the light entering into your eyes, because your cornea is not properly shaped, it falls on different spots of your retina and it causes the image you're looking at to also appear blurry. So now that I've laid a background on refractive error and I've told you about the underlying cause, the reason for which you are having this refractive error, which is the shape of your eyeball, now we are getting close to the answer. So let's talk about how your glasses helps you see better. When you wear your glasses, how is it possible that you are able to see better with your glasses? So when you go to an eye clinic and then eyeglasses are prescribed for you to see better, what your eyeglasses does basically is to bend these light rays which are entering into your eyes so they can be focused on the correct spot of your retina for you to see the image or the object you're looking at clear and sharp. Your eyeglasses are working on the light rays which is entering into your eyes. They are working on the light rays that are reflected off the image you're looking at so they can be focused on the right spot of your retina. Your eyeglasses is not changing the shape of your eyeball. your eyeglasses is not altering the shape of your eyeball. Remember I said at the beginning, that was why I needed to lay that foundation on refractive error. I said that the reason for which you're having this refractive error is because of the shape of your eyeball, which may be too long or too short, or your cornea might be irregularly shaped. Now, your eyeglasses is not altering the shape of your eyeball, which is the main reason why you have this error. Your eyeglasses is working on the light that is entering into your eyes. Remember I said it's because this light is not focused on the right spot of your retina. That's why you have this problem. This is your prescription glasses. Indicate specific dimensions and curvatures that are tailored to your eye needs, so that the light that is entering your eyes can be focused on the right spot of your retina. So this glasses works on the light which is entering your eyes, not altering the shape of your eyeball. Okay, so with this background laid, let's now answer the question, why have I been using these glasses for 2 years, 3 years, 4 years, and each time I take out these glasses, things still appear blurry to me, but when I put it back on, I see things clearly? Shouldn't it have treated the issue you say I am having so I can start seeing better? This is it. Your prescription glasses only improves your vision when you're wearing them. It is at the point when you're putting on your glasses, that is when you are corrected. It is at that point that your vision is corrected, when you are wearing your glasses. When you take off your glasses, you become uncorrected. That means your eyes are back to their default mode, their default setting, which is short or long or irregular. But when you put on your glasses now correct that error by bending the light entering into your eyes. So when your glasses is improving your vision only when you are wearing them. When you take out your glasses, you are now uncorrected. When you put on your glasses, you are now corrected. That is why they are called corrective lenses. I hope you follow. So your prescription glasses, which is also called a corrective lens, only improves your vision when you are wearing them. Now, there's a difference between correcting your refractive error and treating your refractive error. When we talk about correcting your refractive error, we're talking about making use of external aids like your eyeglasses or your contact lens. These are external aids that can be used to correct your refractive error. And what they are doing basically is to work on the light, to bend the light that is reflected off the image you're looking at. In correcting your refractive error, you are not treating the underlying cause of your error, which is the shape of your eyeball. You are not altering the shape of your eyes. Your corrective lens is basically working on the light. It is compensating for the error you have by bending that light so it can be focused on the right spot of your retina. But then when we talk about treating your refractive error, then now we're talking about altering the shape of your eyes. That is, we are looking at solving the problem by treating the underlying cause of this refractive error. When we prescribe eyeglasses to you to correct your vision, our aim is to improve your vision with the aid of your glasses or your contact lenses. What they do is to correct the error. They correct your vision by bending the light rays entering into your eyes. But now when we now talk about treating your refractive error, at this point now we're talking about addressing the underlying cause, the root cause, the reason for which you're having this refractive error. Now we are not talking about addressing the underlying cause. And in treating your refractive error, we are looking for permanent solutions, which will involve surgery. We have refractive surgery that might involve reshaping your cornea and the rest of them. But there are cases where children can outgrow their refractive error depending on the degree of the refractive error. Now this is because as the child is growing, the eyes are also growing and forming. So it gets to a point where the eyes are now fully formed, and that refractive error which was present at the earlier stage of that child's life is now compensated or taken care of as a result of the growth of the eyes. So the eyes are now fully formed, and now there will be no need for that corrective lens or prescription lens which the child was making use of at the earlier stage of his life. At that point, we can say that the child has outgrown the refractive error, but it is unlikely for an adult to outgrow his refractive error. Now, this is because the eyes are now fully formed, and the shape of the eyes, the size of the eyeball are now stabilized at this age. So there's no more growth happening or any change happening to the eyes. They are now at a very stable state. So it is quite unlikely for an adult to outgrow his refractive error. So an adult who uses a prescription glasses to see better would likely continue using that prescription glass to compensate for his error and improve his vision. This is because at this point, at this stage, the eyes are already stable. There is no more growth happening to your eyes, but there is need for you to keep going for regular exams so your prescriptions can be reviewed. Usually we say every 2 years. That is one way to help yourself, by going for regular eye exams. So everyone who uses prescription glasses, and this question has been on your lips, your prescription glasses improves your vision when you are wearing them. Only when you are wearing them. When you're wearing your prescription glasses, then you are corrected. It compensates for your error. But when you take out your prescription glasses, you become uncorrected. Why? Because your eyeball goes back to its default mode. Your eyes are now in its default state. But your glasses serves as aid to help compensate for that error by bending the light which is entering into your eyes, so they can be focused on the right spot of your retina. Your prescription glasses is not changing the shape of your cornea, neither is it changing the size of your eyeball. It is not. It is working, it is acting on the light, the rays of light that are entering into your eyes. It is not working on the shape of your eyeball. It does not treat the underlying cause of your refractive error, which is the shape of your eyeball. So if you want permanent solutions for your refractive error, you want to stop using your glasses, then you go for permanent solutions like refractive surgery, where your cornea can be reshaped, and then you wouldn't have to use your glasses. So to those of you asking me at the clinic when you stop using your glasses, with this explanation now you see that I don't know. The glasses is improving your vision, so why do you want to stop using it? Keep using your glasses, and with time we'll see how it goes. We'll watch your progress and see how it goes. So this brings me to the end of this video, and I hope this video has been able to provide some form of clarity to you regarding the subject matter. Please subscribe to my YouTube channel so we can grow this channel together. Also, give this video a huge thumbs up if you found it helpful. You can leave your questions and your comments in the comment box. I'll be responding to every one of you. And also turn on the bell notification so you'll be the first to get notified when next I post content. Please share this video to as many persons as you think will be needing it. Your friends, your family, your colleagues, even your patients. Share it to them so they can also get clarity on this subject matter. Alright, I hope to see you in my next video. Bye.